Hi, I'm Dr. Sam, a doctor of acupuncture and oriental medicine, a licensed acupuncturist here in California, and also a licensed massage therapist. This video is for assessment of low back pain. This is for the classes that I've been teaching on low back pain assessment and treatment using an integrative approach. We're going to start with doing some manual muscle tests and looking at posture, evaluating if we believe it's a disc issue or if it's something musculoskeletal. Obviously, if you have a patient that's lost urinary or bowel control or in extreme pain, you want to refer those out. Even with patients with really high pain, there's a lot that we can do for them. In that case, you don't want to test. You probably just want to do a little bit more gentle treatment. What we're going to start with is some manual muscle testing, actually after we look at some other postural things. But with the manual muscle testing, you want to think about when the patient is resisting your pressure. If at first their pressure is very weak, then strong, that's more neurological. And if they start off strong but then go weak rather quickly, that's more of a musculoskeletal, and that muscle's inhibited, and I highly recommend you treat that muscle because getting that muscle back online will really help the patient. We're just going to treat one side because of the limitations that I have in this room, but when you're testing, you want to test both sides. I recommend testing the non-affected side first and then treating the affected side. So to get started, we're going to have the patient stand up, have them face the wall, and the first thing you want to look at is posture. Look and see if their shoulders aligned, come down into the glutes, you can push your fingers in, see if the hips are aligned, look at their PSIS, and then also obviously let the patient know, but you can check also with the gluteal fold to make sure that they're even. Since you're here already, one way I like to test a SI joint is by putting one thumb on one SI joint, the other thumb on the other SI joint, and ask the patient slowly lift up each knee like you're marching in place. Good. And the other one? Good. And you go, and then do the other side. All right, thank you. And if you could see in that test, the right SI joint, my thumb wasn't moving at all. So that's something you want to think about and look at. Now you can ask the patient to turn around and go through range of motion. So go side to side, and then go touch your toes, come back up, and now lean back a little bit. Good. You can also have the patient stand on their toes and then go on their heels. If we had more room, you can get them to walk on their heels and toes. This is testing for any radiculopathy, which is when a nerve is impinged. So now that we've done that, we want to go ahead and ask the patient to have a seat. And now we're going to move into a little more of muscle testing. Again, this is just how I was taught. What I found is worked for me clinically, but there are different ways you can do it. So I'm going to ask the patient, go ahead and push out against me. Good. Bring the knees in. Good. Go ahead and push out against me. Good. Push out against me. Good. And take your flip-flops off. And now lift your foot, just this foot, lift it up. Good. Hit the gas. Good. Lift your foot up and point out, push against me. Bring it in, push against me here. Go down and go in. Good. And then obviously I would do the other side as well. Now that that's done, I want to have the patient go ahead and lay on your back. Because low back and hips are always involved, I always like to see what the range of motion is passively with the hip. So I'm going to bring the leg up, just relax, and I'm just going to move the leg back and forth. So it feels a little stuck going in. So I'm going to straighten it back out. And then I'm going to do the straight leg test. So go ahead and I'm going to lift your leg up. Good. And now bend your head forward, keeping your leg straight. Any pain? Good. And along with that, you also want to do the slump test. So sometimes you're going to go through these tests, you're going to forget the sequence. That's okay, just as long as you get them all. So go ahead one more time and sit with your feet facing me. So go this way. Now the slump test, you're going to have the patient slump. So go ahead down, and then you're going to take the leg and and lift the leg up. Like he's really tight. Is that sore or is it just tight?
It's tight.
It's tight, and
Yeah.
now let's go ahead and sit down. Let's try this side. It's very, very tight. So with this patient, if none of the other signs show that there's a disc issue, it's more than likely hamstring. We won't go over this in the video, but when you do the forward fold, you can also place something on the patient's heels to lift it up. And if they can go down further without pain, then that means it's more likely a short hamstring than an issue with the back. Okay, good. Go ahead and lay back. All right. So I like to test the piriformis this way, so going a little less than 90 degrees, push out against me with your knee, and then a little bit more, push out against your knee. Good. I'm going to have the patient straighten his leg, push out against me with your leg. Good. I'm going to push the toes in, push out against me. Good. Now bring the leg to the middle of the table. Good. And now I'm going to have you lift your leg straight up. Good. And now go up here and lift up. Good. Okay. Now let's have you lay on your right side. Good. And then for this one, I like to see how mobile the hip is. So let's have you bend this leg, bend this one, then we're going to bring it back. So that's really tight in the hip flexors. And then if I drop down, the leg's kind of suspended, so that's tight IT band. Go ahead and lay on your stomach. While you have the patient face down, you can palpate along their spine, feel for any sensitivity, especially if you go along the spine, especially where L5, S1 is. There can be a lot of sensitivity there. You can also feel for the paraspinals if one side's really tight compared to the other. That's all things you want to think about. And now I'm going to take the patient's leg. I just want to see how tight their quads are. Not too bad. Now to test their glutes. I'm going to have them kick straight up to the ceiling. Good. And now to test to see if there's any SI joint issues, I'm going to bend the leg like this, bend at the knee, and then I'm going to extend their hip back. Any pain? No. Okay. There you go. And if there was pain in the SI joint, they would have notified. This patient just has extremely tight hip flexors. Let's go ahead and get you to stand up one more time. And as the test goes along, you might find some positive findings, and as you learn more and more assessments throughout your career, you'll find something and be like, let me check this. So for him, I also want to check his hips were level, but are they both anteriorly tilted? So go that way. So lift your arms up. So I want to put my hand on the ASIS, and then I'm going to put my hand on the PSIS and kind of look. So men, more or less, should have a pretty even pelvis. So I would say his is slightly tilted, not bad for as tight as his hip flexors are. And then go to the other side and lift your arms up. And that one looks about the same. Okay, you can have a seat. So I hope that this was helpful. I'll make some more notes in the comments. I didn't do deep tendon reflex. That's something else you can do as well. If I find some neurological issues like a straight leg test that's positive or slump test that's positive, or some muscle testing that's weak with the initial resistance, then I'll go more into depth with those. But for a basic beginning one, all these things are really good and can really help you customize your treatment for that patient and give them a good treatment. All right, thank you. Stay tuned for more.